Myself, Dr. Thipperudraswamy. Today we are going to discuss about learning and neuroplasticity. It's a very simple thing. See, we all know that some students are good at learning and some are weaker. Some students are able to memorize easily and some are not. And we also know that and we think that when we are silent, even our brain is silent. Okay? And one more thing is, when you have the stroke in the younger age, the recovery is more compared to when you have the stroke in the older age. See, when we think about all these factors, the common factor which you are going to think about it is the brain. Remember, brain changes at a breathtaking pace. Remember the word, brain changes at the breathtaking pace. And these changes are, we think that it happen only in the childhood, but not in the older ages. It is wrong. Brain can change at any age. Remember, brain can change at any age. And even at the older age, the brain can change. Brain can learn. There is one more entity called as spot learning, short memories, long-term memories. And all these things, what they are going to tell us is about learning. So remember, neuroplasticity is shaping the brain. Shaping the brain is that you have to shape your brain by yourself. So whenever you are doing some work, it shapes your brain. As for example, there are some professional drivers, taxi drivers in our cities. They have the brain cells of the road maps. So they are well versed with the roads. So they have more cells of their road maps. They have trained their brain themselves. They have done the neuroplasticity of their brain such that there are more cells for remembering the road maps. Similarly, we come across some physicians and some musicians who are well versed with the music. Their brain cells have more related to the music. We have the cricket players. Their brain cells, they have the cells, brain cells more of the which are involved in playing cricket, tactics of cricket, during batting or bowling or fielding. So they are trained themselves. They have trained themselves. They practiced themselves to train regarding that. Now I am worried about our doctors. Now you have to train your brain cells such that you should have the brain cells related to a treatment. You should have the brain cells that is related to a prognosis of the treatment, prognosis of the disease. You should have the brain cells more of the related to the studying of the diseases and to clinical features, laboratory diagnostic methods. You should have those brain cells. And the surgeons should have the more brain cells of the surgical skills. Again, this is not a single day. It takes days together. So my point of view is learning. So basically, why learning is important? It's very, very important. Remember the word. Learning is important to have a good relationship between the doctors and the patients, doctors and the patient attenders, doctors and the nurses, doctors and the colleagues of the doctors. So the learning is very important. Understanding the situation is very important. So learning is a very basic thing. We learn things by three major mechanisms, three basic mechanisms involved in learning. Very basic thing. I try to tell you three major basic mechanisms involved in learning. So very simple. First is chemical mechanism. What is that chemical mechanism? Whenever you learn something, there are some chemical changes between the two neurons. There are some chemical changes between the two neurons. Okay, two neurons. There are some chemical changes. This is responsible for the short-term memory. Short-term memory. So there is chemical changes. Don't worry about whatever those chemical changes. The psychiatrist will tell you there are drugs to induce those chemical changes and all. I'm not going any detail about those things. I'm only speaking what better you can do to improve your memory, to improve your neuroplasticity, to shape your brain in a related way. So I'm only telling about that. So biochemical changes in the neurons happen that form connections which are responsible for these short-term memories. What are these short-term memories? For example, I have learned playing the piano today. So what is the reason for that? Short-term memory. I give a gap of 2 to 3 days or maximum 1 week. I come back. I have forgotten some of the skills. That is called as the short-term memory. Remember, that is short-term memory. So this is responsible, the biochemical changes which happen due to the long gap, they have revert back and you have forgotten those short-term skills. Again, it is a short-term motor skill you have forgotten. So I'm telling it can be short-term motor skill or a short-term sensory skill. What is short-term sensory skill? For example, you are going to your hospital, you receive some typical odor. For example, if you are receive the protease species, it will be a typical fishy odor. Okay. So likewise, the typical odors which you are going to sense it is again the sensory skills and the motor skills. So now I am worried about. So the short-term motor skills and the sensory skills are learned by these chemical changes. Okay, yes. Next, second basic step is, basic mechanism involved is the structural changes. Yes, what are these structural changes? So remember one thing, whenever you're thinking about your structural changes, it should happen over time. It cannot happen on one day. It cannot happen on 1 week. It requires a long time, a month together. These are called as long-term memory, and this is responsible for long-term memory. Remember, this can be possible only with the practice, with the behavior. What is this behavior? For example, if you want to become a good doctor, try to practice suturing with the clothes. If you want to learn quick suturing, try to practice with the clothes. I'm just giving one example. There are so many examples for these. Learning the skills, try suturing with the clothes initially. Do it fast. You learn the motor skill. Then you apply it on the patient. Just one example I have given. So this is one of the method, and it is a long term. And remember one thing: increased struggle, increased difficulty will have an efficient and effective long-term memory. Remember, increased difficulty and these things will make you increase difficulty and increase struggle. See, for example, for learning some motor skill for some surgery, you have struggled a lot. Definitely you will know the value, and even your brain knows the value, and it will form a connection. So it will transform do some structural changes in the neurons such that it remembers the things better. Okay, very simple. Such that it remembers the things better. So this is called as the long-term memory. And here you are, whatever you are seeing is a behavior, is a practice. Remember, for learning anything, for any motor skill or sensory skill, practice is very important. Practice is nothing but your behavior. Remember, your behavior changes everything. Yeah, you need a practice, you need an efficient behavior to have a effective this long-term memory and to learn effective skills. The third most basic important mechanism is, remember, it is the functional changes between the neurons. Remember, whenever there is a functional change, what does that mean, functional change? Very simple thing. That means you have utilized some part of the brain cells effectively. That means, for example, if you are a right-handed person, you left side of your brain, a dominant hemisphere, and it will be stronger and it will be larger. Okay, that means you're effectively and strongly utilizing that part of the brain, and it is easy for you to utilize it again. Again, this is excitation, stimulation. These things are involved in the brain such that this is excitation and stimulation. These things are involved in the brain that will help you to remember things better. So it is the neuroplasticity of the brain which is involved. So you are doing the chemical changes, structural changes, and the functional changes. That means control. Whenever you know to excite this part of the brain, you have used this part of the brain effectively and efficiently. So now you can use that part of the brain very easily. So these three things coordinate. They act in a concrete way, one after the other. They act in a concrete way, and that is responsible for our learning. Remember word learning. So chemical changes, structural changes, and functional changes, they act in a concrete way, and they build a network, and that in turn results in the neuroplasticity. Very simple. Please do remember, it is learning. So these three things, these three changes will happen in the brain that is responsible for learning. Very simple thing. Please do remember. So next, what I mean to say is, one more thing which I want to add here is the dose of behavior. Dose of behavior. For example, dose of practice. The person who does more practice will be definitely more efficient. It is called as dose of practice. Same dose of behavior. He will be more efficient. For example, if you want to learn good batting skill, you should have a daily practice of 4 to 5 hours. If you want to become a good surgeon, you should have a daily practice of surgeries for more than 5 to 6 hours. That's what I'm trying to say. Practice. Only thing which makes you perfect is practice. So dose of behavior, dose of practice is very important to learn the skills better. And one more thing is, I always used to tell to students, that is, train and prepare your brain. Train and prepare your brain. What is the better thing I can do to train and prepare my brain? Please do remember. So, stimulation, exercises, and rewards. What the better thing I can do to? It is always stimulation, rewards, and exercises. So first thing I can do is structural change. Greater the structural change in the brain, the more the learning. Okay? Greater the structural change in the brain, the more the learning. So next thing which we have to remember is, the neuroplasticity can be either positive or negative. Remember the thing? Neuroplasticity can be either positive or negative. What is this positive neuroplasticity? Very simple. Positive neuroplasticity is the things which we have to do to have a healthy mind. And the negative neuroplasticity is, so if you are not doing some things, for example, if you are not doing if you are not taking the alcohol, your brain is prepared for that. So preparation of your brain for that is called as the negative neuroplasticity. So the things which we are doing, the brain is prepared. At the same time, the things which are not doing, again the brain is prepared for those things in a negative way. So that is called as negative neuroplasticity. Remember, there is no recipe for learning. There is no recipe. So you yourself have to create what to learn. You yourself have to see what to learn and what not. And one more thing is, we also have personalization or individualization of learning. Please do remember, personalization or individualization of learning is, some students can learn the skills in 10 minutes, whereas some students can learn the things in 1 hour. So it is this differences are there only because of their brain cells, their neuroplasticity. They have prepared their brain, and there are, for example, some students are good in reading, some students are good in sports. Why? Because they have prepared themselves. Their brain, they have prepared their brain. They have done the neuroplasticity of their brain such that they have more number of brain cells related to study, and these people have more number of brain cells that is helpful for the sports. So, and one more thing important to behavior. Everyday behavior is very important. And why it is important to have a good relationship between the teacher and the learner. So, yes. And one more thing which I have to tell you is, yes, with the time, each of us have done the neuroplasticity of our brain such that we have trained ourselves, we have created our brain such that the things which are important to us or we are interested, we have trained our brain. That means we have shaped our brain ourselves. Now your brain can be changed. Definitely changed. Remember the word, your brain can be changed. Now, even at your older ages, also your brain can be changed. It all depends on you. Just like how you sharpen your saw, if you keep the saw without working, it will rust. But if you keep on using your saw, the sharpness of the saw will remain. Similarly, your brain cells, if you keep your brain cells activated, they will work effectively. So there is one more thing. Again, these things are very important between the parent and the children, teacher and the children, manager and the employee, and for me, doctor and the patient. So we all know that learning is a lifelong process. So when you are learning, learn the best. Learn the best. Doing the work. So learn the things which makes your work better, think better, and you perform better. So constantly, because of this motor behavior, you have constantly shaped your brain, and the world around you also influences your brain. Remember that this social support are the world around you, and the people who meet, and the people who are talking to you, and you react, the way you react, the way you express yourself, everything shapes your brain. Remember, your behavior shapes your brain. Neuroplasticity is the product of your behavior. So whatever things you do, whatever things you behave, everything is related to your brain. That will shape your brain. Everyday behavior will shape your brain. So remember, your behavior will shape your brain. And I also try to tell you that you build your brain which you want. Remember, you build your brain which you want. That is in your hands. Whatever may be the situation, whatever may be the social support, whatever may be the people around you, you yourself can build an effective brain. Remember, you yourself can build an effective brain. Definitely, these are the people around us. They influence us. They will try to shape us. Again, it depends on you. It's the product of your thinking and your behavior that shapes your brain. So you definitely have a control on your brain. Yes, we all know that before listening to this video, your brain was not. Now use your brain. That means before listening to this video, your brain was different. Now after listening to this video, your brain is different. That's what I mean to say. Some neuroplasticity this video has done in your brain such that your brain is much better than was earlier before this video. Again, so brain learning is all about your matches, neuroplasticity between the teachers and the students, and doctors and the patients. Repeat those behaviors which are healthy, which help your brain, and break down those behaviors which are not healthy. And for example, I want to say one more thing. The learning music is easier for some people, and learning sports is easier for some people. Reading is easier for some people. What is this difference? This difference is all about the brain cells which they have developed over years because of the neuroplasticity, which is making them easier in these situation easier in these professions. So that's why all the doctors, all the medicos should have the brain cells in their brain, should shape their brain, should do the neuroplasticity of their brain such that they can practice better, they can give better treatment, and they can interact with the patients better. So everything you do, everything you encounter, everything you express, everything will change your brain. But that can be in a better way or in a worse way. It all depends on you. And now, neurons that fire together, that can wire together. Neurons that fire together. Remember this slogan, neurons that fire together can wire together. Neurons that fire more, that can wire more. So it's all about how you utilize your neurons, your brain cells to have an effective brain. And last but not the least is neuroplasticity. Again, some people say that neuroplasticity is nothing but memory and all. I would rather say it is the brain changing depending upon the situation and the events which have occurred. And last but not the least, contiguity leads to continuity. Contiguity leads to continuity. Remember two slogans. Neurons that fire together, wire together. Neurons that fire more, wire more. Contiguity leads to continuity. Contiguity leads to continuity. Now I have one more thing. Yes. So you have, definitely your brain cells are such that they will support your brain recovery. Remember the word, everyone has a brain cells which are such that they will support your recovery. That is very important for you. And whenever you think about the brain recovery, you should always think about the neuroplasticity. Remember, and at whatever may be the age, whatever may be the situation, you yourself have the capability, the ability to build and reconstruct your brain according to your needs. And now I want to tell you very few measures to increase the neuroplasticity of your brain. See, two basic things. I remember it by SE. Always remember, S stands for sleep. Always remember, good sleep is the only medicine for good brain. Good sleep, good brain, healthy brain. Good sleep, you can work fast, you can react fast, you can think fast. Okay. So next, one more thing is exercises. There are so many studies. I'm not going any detail about those studies. I just want to say that good studies good exercises will help you to increase the number of the neurons in your brain. So whenever you are doing the exercises, regular exercises, at least for 2 hours a day for the youngsters, at least for 1 hour a day for the old people. Remember one more thing, just by clapping you are relieving of so many diseases. That's why always remember, do exercises, take a good sleep. These are the only ways to have an effective, active brain, and you can reconstruct your brain. That is neuroplasticity. So avoid coffee, nicotine and alcohol. Relax before you go to sleep. Remember these things, sleep, exercise, avoid coffee, nicotine and alcohol, and relax before you go to bed. If you are sick, and one more thing, remember, don't sleep when you are awake in the bed. Don't go to bed when you are awake. Make sure that you are tired enough, then only you go to bed. And avoid activities in your bed, okay? Avoid activities in your bed. Remember, sleep, good sleep, exercises. And don't go to bed when you are awake. And don't be in the bed when you are awake. And go to bed whenever you are only awake, okay? Whenever you are tired only, go to bed whenever you are tired only, and don't do any activities in the bed when in the bed. So avoid activities in the bed. And last is to sleep until sunlight. I don't know what yoga, some people say that better you get up in 4 o'clock, 5 o'clock. I don't know about anything. I will suggest that please do sleep until sunlight. Please do sleep until sunlight. Avoid activities in bed. Go relax, completely relax before going to bed. And if you don't be in the bed when you are awake, and keep your bedroom dark, cool and quiet. Remember, dark, cool, quiet, DCQ. I remember it as DCQ, dark. Keep your bedroom dark, cool and quiet. And last but not the least, avoid using bed for other activities. This has already been discussed. Please do remember. So this is a small video about learning and neuroplasticity. Remember, everything is in our hand. Brain is always active. Remember, brain is always active. Only brain is not active or is relaxed during sleeping. So you should have an effective sleep and sufficient sleep. Then only your brain can work better. Thank you so much. Myself, Dr. Thipperudraswamy. I have written book on personality development system. It is everything is there in the book, and this video is done to enlighten your knowledge on learning and brain structure and those things. Please do follow everything is there in the book. Please do follow the book, and this is a short video to enlighten your knowledge on learning. Thank you so much.